This is Call the Psychiatrist, the show where psychiatrists answer your questions. I'm Dr. David Handley.
And I'm Dr. Abby Snavely.
On today's episode, we have two listener questions. Our first listener is concerned about agitating their therapist and is curious about repairing ruptures in a therapeutic relationship. The second question comes from a listener wondering how their therapist avoids becoming emotionally invested in their patients' lives.
Say you like me, you better count the ways.
Hey, so this is the first time I think we've done an episode we have not actually talked about these questions or our answers together before we recorded.
Okay. I mean, is there like going to be a big reveal? Do you have something?
No,
you might have to alert me when it's the finale.
I'm worried about the editing ahead of me. Yeah, I think it's going to be, it could be a mess. That's all.
Well, every good therapist has some masochism in them, but maybe we'll get to that later.
All right.
Well, okay, fine. And if there's masochism, there's sadism. So we'll let the listener decide who's on which side of it.
That's pretty obvious.
Is it? Okay. I'm the mean one.
So these two questions that we have, though, different listeners, different days they were submitted. There's a little bit of a theme. They both are interested in what their therapist is thinking or feeling at some point. So I thought that was interesting.
I think it is. We're going to pull back the curtain a little bit, say what we think, maybe some theoretical things, but also our experiences. Yeah, I am excited because maybe you have some stories I haven't heard before.
A lot, I'm sure.
A lot. Okay,
Yeah,
I know. You've had a rich life.
A rich professional career. That's right. All right. So before we get to the first question, just a quick reminder that listening to this podcast doesn't mean we have a doctor-patient relationship. Our intention is to educate and entertain you. Nothing we say is intended or recommended as a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your own physician or other qualified health professional regarding any medical questions or conditions. Our first question comes from Yolanda.
Thanks for doing this podcast. You've talked a lot about the relationship between a client and therapist and say it is key to the process. You've also mentioned how important it is to fix a rupture, and I'd like to understand more about this. What exactly is considered a rupture in therapy? Is it an argument or can it be a minor misunderstanding? Who is responsible for identifying and fixing a rupture? How do you know when it had to be solved, or should you simply move on? I can tell I agitate my therapist fairly often. He fidgets and gets a pained look on his face. It makes me so uncomfortable. I know Abby's going to say, talk to your therapist, but I'm so afraid he will terminate me.
How predictable you've become, though, already.
Already.
10 episodes in.
Listen, some people want to hear the greatest hits.
Okay. Before we get into the ruptures and repairs, which, by the way, I think is important, not just in therapy, but I think in all relationships, but I'd like to focus on that last part of the question, the idea that Yolanda agitates her therapist and worries if she's going to be fired if she brings something up. This may not be very helpful. It may not work, but I wanted to share what my immediate thought process was after I first read that question. First of all, I had two emotional responses. The first was that, this is just some terrible misunderstanding. There's nobody at fault. This needs to be fixed. It can be done so quickly. Just clear the air. And then I had my savior complex kick in, and I thought, and I wish I were kidding, but I thought, I should be Yolanda's therapist because I wouldn't fire her over this. And I probably wouldn't even be agitated by her. Now I quickly extinguished that by something snarky like, have you not fed your ego today? Isn't your cape in the wash or something like that? So then I became more rational. Because I realized that, yes, I might actually get agitated too. So then I thought, okay, well, what does that mean? Let's think about the therapist for a second. So if it were a one-time thing, we could think that it has nothing to do with the relationship going on here. Maybe he's preoccupied by something outside the treatment, but we're told that it happens fairly often. So that's probably not it. And so one possibility is that he could be agitated, but he's failing the situation because he's not talking about it. He's only communicating it non-verbally. And this is something that would need to be talked about openly. And then a third scenario might be he's not agitated, but he's not really monitoring the relationship closely enough to understand, that the patient is feeling like she's bothering him. So that was kind of my initial thought about what's going on that side of the room. And then I immediately thought, well, what's going on possibly on the other side of the room? And so one possibility might be that the therapist isn't agitated at all And maybe the patient has this tendency to think others are frustrated with her when she's asking for help or talking about herself. Maybe she's used to being dismissed, or maybe she's been abandoned before when she tries to get her needs met in a relationship. And if I thought that might be happening, then I'd be curious about what those relationships are like. Is it someone in her life now, a partner that dismisses her as needy, a boss that's easily frustrated when she asks for help or time off or something like that? But I'd also be curious if there were important people early in her life that got irritated when she was hurt or needed help.
And I actually think that last piece about being afraid that the relationship would end if it's addressed, that part really seemed like a clue to me that it might have something to do with other relationships. I think people should be able to bring it up with their therapist, and that fear that acknowledging something that's happening, maybe acknowledging the truth, acknowledging your impact on someone else. I don't know which part of it, but that bringing it up is going to destroy the entire relationship. That really sounds like a feeling that's being carried over from another relationship.
Yeah, which is why observing it is going to be so important. There's this one other element that I would be curious about in relationships. If there are people that have to reassure her quite a bit that they're not angry with her. In other words, people that do care about her, but she seeks reassurance that she's not bothering them. And so what might that mean? And how does that transition? And then there's a final scenario, which I would never start with this because you would sound like you're an out of touch monster if you went for this without context and a high index of suspicion. And I don't think it even applies to this listener, but just, in terms of my initial thoughts, there's a scenario where the therapist is annoyed because the patient is being annoying, right?
Sure.
But it's not that straightforward, because then what would need to be investigated is, well, what's the benefit of agitating other people? Like, what's the payoff? Is it that you agitate others and so then you ensure that you're treated the way you're accustomed to being treated? If people have abandoned me or rejected me for no reason, is this a way to have some control? Or to have some clear behavior to point to and say, well, this is why they didn't like me, or this is why they discredited me and ultimately left me. And I think the interesting thing is that it could actually be all of these things or none of these things, right?
Sure. Like some combination.
Yeah. But I think just exploring this what seems like a very tiny thing in the relationship can open up all kinds of potential insights.
Well, and not just open it up, I think by not addressing it, that there's going to be this obstacle, right? I mean, that there's something that will be in the way of the therapy. Even if Yolanda decides to put this away and just move on, I don't think these things ever totally go away, especially if it's recurrent. And I mean, I understand that the relationship is important and I don't want to be too, dismissive or blasé about it. But part of me also thinks if the therapist can't answer an inquiry or someone noticing something about what's happening and terminates, and that's not somebody you want to be with anyway. I mean, if he really can't handle it for whatever personal limitation he has, that's too bad. And there would be pain and grief associated with losing this therapeutic relationship. But I sort of think it has to be addressed to move forward, hopefully move forward in the relationship with this therapist, but it may just be moving on to either a break from therapy or a different therapist.
Yeah, it's really hard for me to think that termination would be the outcome of this.
I don't think so either. But again, if it is, then this isn't the right guy.
Yeah, right. And I was thinking of examples where patients read me differently than the way I actually feel.
Yeah, that happens.
Yeah, not too long ago, I broke eye contact for a second to write I really just wrote one word in my notes to remind me of something to come back to. I mean, not a shopping list, but it was just, just something to remind me. And I could tell that the patient felt like I dismissed him and that maybe I wasn't interested in the story. He immediately switched topics. And so there's this momentary rupture. I didn't address it that time, but I paid attention to it, and then I noted it when it happened in other contexts a few other times, because I thought I really needed more examples before he would consider my observations.
I like what you're saying about collecting evidence or having a lot of examples, but sometimes you could go for the direct, it seems like you felt dismissed because I made a note. But sometimes I'll just be like, what just happened there, right? And then people can say nothing. And it's like, oh, I thought I felt a shift. That kind of leaves it really open and not confrontational. But I don't know.
Yeah, we were a little too early on for me to even
that's
be
fair.
that direct. But yeah, no, I hear what you're saying.
Yeah, some people don't want to know that they're being scrutinized in that way. Like,
well, until they do realize it, right? And then they catch it themselves. And that's really cool too. And they're like, oh, there I am. I'm feeling dismissed and I don't know that. So you then can talk about it in real time.
Yeah, I mean, and sometimes, I mean, I like what you're saying though, that it can be the smallest thing or something that seems small. And it might be something that your patient felt slighted by on that day, but not on a different day when he's in a different mindset. And that people are different. People are different selves, but also like different patients are different. Probably you're pointing this out because I think most people don't mind when you write something down, right? Like they just think it's part of the process.
Right.
But for this guy, it was a thing.
Yeah. There's another example that came to mind, which it's a patient that perceives disappointment in my eyebrows. Right. So, whether I'm disappointed.
That's what Botox is for, Dave.
I know, right? So whether I'm disappointed or not, he expects me to be disappointed in him. There's something that's happened, so he's anticipating it, believes I should be disappointed. But, to be perfectly honest, with all of these video calls, having to look at myself, listen to people on screen, I realized that I have a resting annoyed face because my brow is so wrinkled. At best, I look like an earnest hound dog, but at worst, it looks like I'm fuming when I'm actually just concerned.
Right. There's much more scrutiny. Yeah, I mean, I do actually think I've read articles that there's more cosmetic procedures in the age of Zoom. We were not made to be looking at ourselves like this all day. I'm always like, God, this is horrifying.
Right.
Yeah.
You could turn the camera off, but yeah.
Yes. But so, but some people are just hyper attuned in general for good reason, right? Nobody's making this stuff up or trying to be difficult. And so we maybe are scrutinizing the patients, but they're often also scrutinizing us. I mean, one time I was just wearing a black dress and maybe more dressed up a little bit than usual, though I didn't think it was different. And, one patient was sure I was going to a funeral. Another person was really sure I had like a hot date afterwards. Right. That's the one that made you laugh. But the part of it that it means different things to different people. And that also, as a therapist trying to be consistent, I mean, I don't think there's anything wrong with, I guess, introducing things, but some of that's noise. I guess that's your first point. Like, is the therapist fidgeting because he has a bad back? Or he's distracted, or, I mean, it could have something to do with the patient or nothing to do with the patient.
Yeah, right. But it has to be explored. There's no way around it.
Yes. Our old boss, who you referred to recently as your favorite psychiatrist, would frequently give me the feedback that I had too much facial affect. So that I really needed to figure out how to make my resting face, I guess, just be more rested, that I was communicating too much.
Which is bizarre. That person has the most animated face I can think of.
I'm telling you, I know, but...
we always see our faults in everyone else, don't we?
We do. But anyway, maybe this guy just needs to figure out how to sit still, but that's probably not it.
Yeah, or maybe it's the 6:00 appointment. Maybe this happens to be the last appointment of the day, and he's struggling, and so he needs that feedback. He needs
to do some yoga and make it a 6:15 appointment,
or a 3:00 and cut out early. I mean, I don't know. There's so many possibilities. Yeah.
So she is worried that this is going to be a rupture that turns into a termination or some impasse or something that they can't get through. But maybe this is a good chance to talk about the rupture and repair process.
Yeah. And again, as I said earlier, this is really important, not just in therapy, but if you're doing couples work, I feel like this is one of the first skills to work on is revisiting a rift in a relationship, revisiting an argument, a disagreement. Couples in general start getting this idea that they can't go back to try to repair something, that if they go to pursue it, it'll ultimately cause the argument to start anew. It'll just be worse. And I think when both parties want a relationship to work, that hardly ever happens.
Right. Yeah. I mean, and conflict avoidance is a very, popular strategy in the population at large. But I also think, your point that yes, this is important in therapy and important in life. But really, all this stuff that we're talking about in therapy, the reason why we care about it and the reason why it's important is so the person can use this to live a better life or live the life in a way more aligned with what they want and be more effective in their relationships. I mean,
right. You overcome your avoidance in the therapeutic relationship so that you can overcome your avoidance in other places too. Right.
That's right. Like it might not be socially acceptable to tell an acquaintance. I mean, maybe a good friend, but to tell an acquaintance, why are you so shifty when I'm talking to you?
Oh, right. Or I broke eye contact and now you're upset.
You broke eye contact. Right.
Of course.
Yeah. So you actually, there's like good here and now information. Like this is actually a really important opportunity to say, okay, I've noticed this thing that's happened. Here's my perception of what's going on. And then you get to hear the therapist's perception of what's going on. Like it can be really instructive, not to mention just something to work through, to be able to say, like you said, Dave, like, no, I'm not annoyed. I just realized that I look like a hound dog. No? Is that a good therapeutic intervention?
I mean, I don't think I would.
You wouldn't say it that way?
No, I wouldn't be so self-deprecating in therapy. That's just for the podcast.
Oh, it depends on the person. Sometimes they need it. Sometimes, it's okay to show some faults.
They're
be
pretty
human,
obvious.
if you will.
They're pretty obvious on the camera, I think.
Is that right? Yeah, no, yeah, for real. Anyway, so I think it comes down to, or it can come down to, a rupture of mutual trust, that something has happened where the patient doesn't feel like they can trust the therapist, right? Trust the therapist to, in this case, handle it, trust the therapist to be consistent, trust the therapist to be helpful, and that something has happened to make this rupture in the relationship or the alliance, and that it needs to be repaired. That maybe it's a misunderstanding and you talk about it and you move on. But I think often if it's a real rupture, it goes deeper and there's an emotional tie to what has happened, or there's, the person has given it an emotional meaning.
I think in the therapy situation, she was wondering who takes the ownership. And I would say,
yeah,
I think either party, it's their responsibility to bring it up if they've been hurt.
Mm-hmm.
I do think in therapy, though, the therapist should be more responsible. They should have a little bit more of that burden, because they should be monitoring for opportunities to mend any ruptures.
Well, but they also should be paying attention to what's happening in the room, but also having observing part of their mind that's looking at the process. It's the therapist's job to also be holding steady emotionally during this, right? I mean, I want my patients to be able to feel whatever they feel, say what they need to say, get mad, get whatever. I mean, and actually, I don't know, yelling back or arguing or crying with them or whatever it is probably not appropriate.
Yeah, but I think the therapist should be inviting a person to bring up what they've perceived as a rupture, in the same way that the therapist should, of course, be monitoring them all the time, but also making sure that there's an opportunity here, so that there isn't a threat of termination just because you bring it up.
Right. Yeah. I mean, I think the therapist in general is responsible for creating an atmosphere of safety. That doesn't mean that every person is, immediately going to feel safe, especially if they've been hurt in their past. But that's some of the stuff about the frame that I know we've talked about before. But if something has happened where the patient feels like that the therapist isn't holding his or her stance or creating the safe, trustworthy environment, then I think it is on the therapist to try to restore that. It doesn't mean the therapist can do it on their own, but I think it's mostly the therapist's responsibility, if the patient doesn't bring it up, to bring it up so you can work through it.
Yeah. And then I think that last question, I don't know that every disagreement, I mean, if we're going to call it a rupture, I don't think everyone has to be resolved or brought up. In that example I used earlier about looking at my paper, I wouldn't have necessarily brought that up if it had just been the one time, but it still, by paying attention to it, it gave me information about my relationship with the patient. And so I monitored more closely. And because it was repeated and because it fit with the context of what we were working on, then it became important. But had it just been a one-off, I may have noted it, but I don't know that I would have needed to interpret it. I don't know if I would have had to make such a big deal out of it or a topic of discussion.
I don't think you would. I 100% agree. I don't think you need to. You definitely don't need to immediately. But if something happens and it seems on the surface like you've moved on, but then something isn't quite right or the two of you are stuck, then I may have something like that flagged in my mind to go back to, because maybe it did mean something either that the person was aware of or not aware of. Maybe it did have a bigger meaning for them. If things changed after that time, I think it would be a good clue, because somebody might be embarrassed to say, I know I'm too sensitive. My mom always told me I was too sensitive, but it really hurt my feelings when you did X, Y, or Z, right?
Yeah.
And they might cognitively or intellectually be able to forgive you or realize it's not a big thing. But if the emotional impact goes on, I think there will be other signs that it wasn't really put to bed.
Mm-hmm. I'm wondering if we can generalize this idea of rupture and repair just a little bit more. I advise people to pursue talking about conflicts with important people in their life. I think it's the best opportunity to try to understand what's happening in the relationship if somebody's not getting their needs met. There are plenty of ruptures or disappointments that don't need to be attended to because, people aren't perfect.
Yeah. And at the same time, if something is sticking around, I think that, as you said, pursuing that conversation or pursuing some sort of understanding, I think can be an opportunity to really, strengthen the relationship, to understand each other and maybe ourselves better. And I think that is really rich, rather than just pushing everything under the rug in the service of keeping it moving every time.
Yeah, I was thinking of an example. I think this one's pretty common.
Okay.
So a couple gets into this screaming match pretty frequently about who left the pantry door open. Everybody's defensive, emotions are running high. If it's talked about again, it's usually to determine who was right and who was wrong. And then the scenario repeats the next week. Maybe it's about the dishes. Maybe it's an errand somebody forgot. Maybe it's about the pantry door again.
Which is like a total waste of time, because in my house, I'm always right, and I don't even understand why we are arguing about it.
Right. Well, that's convenient to always be the
Isn't
right
it?
one. Yeah. But in other households, not yours, I think ideally, if you go back to revisit these surface arguments, it's hopefully to uncover some of that deeper emotional meaning that you were talking about earlier. Because of course it's not about the pantry door when there's that much conflict and that much hurt feeling going on. But that's an okay starting place.
Mm-hmm. Yeah, I think that the next level down from the pantry door or the dishes or whatever is maybe the next thing underlying it is a sense of disconnection, and that the hurt feelings are because, someone isn't feeling loved, connected, respected, understood in the way that they would like to with their partner. And I think you're right that we can solve the argument of who's right or whose responsibility it is. But I think that those things, rarely become such a big deal when people are feeling deeply connected and in partnership with the important people in their life.
Okay, so you're saying the next level is about connection, chronically feeling disconnected, getting your feelings hurt.
Mm-hmm.
And then I think, as a couple, and I mean any partnership of any kind, a friendship or whatever, if you want to keep digging
Therapy
even
relationship
further, right, or even in therapy, then, when people are fighting, it's all about, it's all the heat of the battle. Nobody's going to be able to just stop midstream, turn it off and just say, I don't know, yes, darling, I left the door open in a passive attempt to restore a power differential. I don't feel appreciated, and I want you to feel that same hurt. It's just like...
It's so much more efficient to, scream expletives and accuse somebody of not doing their part and slam the dishwasher shut.
But if you ever can get to that deeper level, you could probably solve more problems, right?
So much to think about. You're right. But that's a lot of articulation when you are feeling hurt and betrayed.
Right. It's one of those times when understanding somebody is still not quite enough.
Yeah. It's good. You can get there later. That's why there's always another opportunity, right? What do they say? It's not what you do, it's what you do next.
Sure.
Well,
I hope that's been helpful. We are going to take a quick break and give you a recommendation for another podcast. But when we get back, a listener wonders about how therapists avoid becoming too emotionally invested. All right, we want to tell you about an excellent podcast you're going to love. It's Ask the Therapist with Sarah Rees. Sarah is an accredited cognitive behavioral therapist in the north of England. She also has training in EMDR and compassion-focused therapy, and earlier in her career, she worked as a mental health nurse. On the podcast, Sarah interviews experienced psychotherapists about a wide range of topics. Some of the recent episodes I've enjoyed included one about pregnancy loss. There was one about increasing your confidence in public speaking, an episode on perfectionism, which really hit home for me.
Yeah, I really enjoy Sarah as well. She's super knowledgeable. You can tell she's an expert. She has such a soothing, compassionate voice. A couple of my favorite episodes actually were solo episodes. One was about managing uncertainty, and she really got into the functions of worrying or over preparing. She also has things on being sober, also episodes about her path to becoming a therapist. Again, it just feels like she has a deep compassion and understanding for people.
Yeah, I agree with you. She's very warm, comes across so compassionate.
And actually like pretty practical and helpful.
Yeah, that's what I came away with. Like, she's actually more helpful than we are, I think.
Way more helpful.
And way nicer.
She actually is like...
Yeah, way nicer than you, certainly.
How dare you?
Also, her website has a lot of great information. There's a blog where I found a great article on imposter syndrome, and she has a CBT journal, which is such a useful resource to help anybody get started with CBT. You can find out more about Sarah at her website, sarahdrees.co.uk. That's SARAHDREES. And we'll have a link in the show notes, of course. You can find her podcast, Ask the Therapist with Sarah Rees, at her website or wherever you listen to podcasts. All right, so we're back, and our next question comes from Jan or Jan. I'm not sure. It's either. I think I'm going to go with Jan, but it could be Jan.
We don't have pronouns, so we're just going to guess.
I'm worried about my therapist because of all I share with them. Some of it is objectively disturbing. I wonder how you avoid becoming emotionally invested in your patients' lives. Is this covered in your training? So I think we could talk about this in two ways. I think there's a broader context, and then there's the specifics about becoming a therapist and what does that mean. Mm-hmm. I think that for a lot of professions, there's a self-selection process, whether you're going into medicine or nursing, or you're a first responder, like a firefighter, a police officer, EMT, medical examiner. Anything, social work, physical therapy. If you're joining the military, I think that one thing those all have in common is that they're exposed to human suffering in one way or another. Yeah. And I think that people who pursue those fields already have some ability to compartmentalize things. I don't think they would pursue it if there wasn't something about their makeup that made it a little bit easier for them to not be traumatized. Not to say that they can't be, but I think it's possibly less likely for the people that go into those fields.
The people that these folks can be a pretty good container absorber. Maybe they had experience, like you said. I think some of it, makeup, upbringing, whatever it is, but a pretty high tolerance and ability to contain a lot of either expressed emotion or dramatic stories, dramatic feelings. Things that we are that we're both interested in, but also can handle.
It reminds me of like somebody in college saying, "Oh, well, I was going to be a doctor, but I don't like the sight of blood." And of course, I also think, failing chemistry doesn't help you either. But there's probably some truth to that, which is that, I don't like that. I couldn't overcome something like that. And so the very same traits that would make a really good homicide detective are different, but maybe share something in common with somebody who's a pediatric trauma surgeon. Like you're saying, the ability to absorb something like that, or to be able to distance themselves enough to still be helpful.
Or even just to be able to move in between engagement and action.
Yeah. If your house is on fire and you've got a child trapped inside, you don't want your firefighter to get there and get panicked with you and hug you and start crying, right? Like you want them to jump into action, save the baby.
First things first.
Right. And then have an emotional moment. And I'm not saying that, I'm not trying to equate therapy with saving babies and burning buildings, but it's important that in that relationship, you're strong enough that the person knows they're not going to have to now take care of you because they've exposed you to something from their past. When they feel like they have to take care of us, we've
let them down.
Yeah, right.
And maybe reinforced feelings of shame or being too much or guilt or whatever else that like might very well be the reason or one of the many reasons a person has come to therapy.
Mhm. Well, and I thought of an example that I think a lot of people might be able to relate to. Like if you've ever lost somebody close to you, or if you've just witnessed a person who is acutely grieving, you'll know what I'm talking about. There's these well-intentioned people, they're acquaintances, and they're certainly grieving in their own way, but they come up to the bereaved, and then they become so focused on their grief and themselves and their experience of loss that all the focus is now on them. And then the person that they came to comfort is now responsible for taking care of them emotionally. So we all know that that's not useful. And so it wouldn't be useful in therapy if we couldn't maintain that boundary of what is yours and what is mine. And I think the training in therapy isn't really about this. It's not about how to tolerate trauma, how to tolerate grief and loss. There's a reinforcement of the fact that one thing you have to learn if you're going to be effective is this is my baggage and that's your baggage. And our work here is to unpack your suitcase. It would be inappropriate to unpack my suitcase, right? So at the end, it's like
unpack your suitcase with your own therapist.
Right. We can look at this together and we can try to make, if there's a way to make sense, if there's a way to help you move forward, but it gets repackaged and you take it back with you. I actually don't take it. It's not mine to take because I know what's mine and I know what's yours. And so again, it doesn't really answer the question, like, are you trained? It's not trained specifically about what this person's asking, but I think that's where some of it gets reinforced. In fact, I would say, at least in medicine, which is what I'm familiar with that. I'm not sure about some of the other disciplines I talked about earlier. I think it's looked down upon, at least it was historically. Like you weren't supposed to talk about it. You weren't supposed to have feelings or emotions or be affected by anything. No matter how traumatic the experience, there was always another patient to be taken care of. There's always another, ambulance pulling into the bay. And it's one of the things that contributes to burnout because,
absolutely,
people are the caregivers objectified. They start objectifying the people they're caring for. They're too depersonalized, too desensitized to what's going on in order to survive. And then that leads to moral injury or burnout or whatever.
Another way, I guess, to say what you're saying is that there's various ways that the caregivers cope with this. And so compartmentalization is a great coping skill, especially while you're at work, right? To keep all of that separate, to be able to focus on your job, move to the next patient, do what you need to do. Sometimes maybe it takes a form of gallows humor. There's definitely in certain professions amongst those you listed, there's definitely higher rates of substance abuse, which obviously would be maladaptive coping. But sometimes, the compartmentalization, like I said, is great when you're at work. And then maybe once you're away from work, maybe that's the time to feel it, process it, maybe go to your own therapy, maybe have a drink, maybe have a cry, have a whatever to kind of let it out. But, being really reactive in the session isn't going to help anybody.
Yeah, I've noticed a trend where the caregivers are more encouraged to talk about this.
I feel like there's a lot of stuff about like compassion fatigue, right?
Yeah. But I mean, even like visiting with people in a trauma center after some horrific, a death of a child from child abuse or something like that, and inviting it not just after work and not just that you have to go to the bar, but it's actually okay to, to take a moment to take care of yourself and to talk about these things in more real time. And again, I think that was discouraged for a very long time.
Oh, yeah, I agree. I mean, I've heard more recently of support groups, though, even when those things were made available, they were not always well attended.
Yeah.
That I think it's not just discouraged, that it's a weakness, but also maybe an idea that makes you bad at that job if you feel it, or that, if you let it out, you won't be able to put it back together.
Yeah.
I mean,
and there's so much shame too. I mean,
so much shame.
A patient dies in psychiatry, a patient completes suicide. I mean,
right.
No one talks because the person's so ashamed that they've done something wrong. So then people treat them like they've done something wrong. So
I was going to say, the system definitely supports that sometimes.
Yeah. And I do want to say, though, that this is not to say that we don't still think about our patients, like when we leave them.
Oh, and that's what I'm saying. Like, we can come home, like, after the session, I might, put my head in my hands, but...
Right. Or that we don't grieve with them or whatever. But yeah, there's the right time and the place for that.
Yeah. I think that's what it's about. I mean, I know Jan says that some of the stuff is objectively disturbing, but I've definitely heard about some very extreme situations in my work, and I'm sure you have too. And maybe I did need extra supervision in terms of maintaining those boundaries or figuring out what to do with it, because it wasn't, in my experience, just kind of like run-of-the-mill stuff that might be horrible and painful, but things that are pretty graphic or vivid. And, that is going to be harder to put away. There are stories that just stick with you.
In terms of the question, I'm not sure all the motivation behind it, but I think if you're thinking you need to take care of your caregiver, that has to be talked about.
Absolutely.
And it's possible that this person's therapist is having a hard time, and it's not for Jan to go recommend that this therapist get help or something, but
right.
I don't know. If it's getting in the way of her treatment, it really has to be talked about. This might be too negative, but I have noticed that some people in the profession, in a mental health profession, that struggle the most with this kind of thing happen to also struggle with boundaries.
I think that's fair. No, I don't think it's too negative. I mean, again, I think you have to talk about it and explore what it's about. I mean, how the question is written, it sounds like it's more of a content question, if you will, that, the details in and of themselves are disturbing, which is one thing, right? If Jan just thinks like this story is too much for most people to hear, and, I'm coming to my therapist and every time talk about this and I'm worried about it, versus more like Yolanda's question in the first half of, is the therapist indicating that they're uncomfortable, that they're traumatized? Are they trying to get away from it?
Yeah.
Is there an actual indication that it's too much? And that would be more of a process problem.
Mm-hmm. Yeah. Okay. Let's see if we can wrap this up. Back to the question, I think we do become emotionally invested. I don't think there's anything wrong with that, but that doesn't necessarily mean that we're harmed by that. I think with good boundaries and good training.
No, absolutely not. I mean, I should hope that we have some emotional investment. I mean, this is what we spend a lot of our lives doing, at least our working life, right, is trying to help people. And I think it would be not great if we didn't care or there wasn't some level of emotional investment. But I think the question is more about overinvestment. And the question is also, I think, a fear of being too much or overwhelming your therapist. But I also want to say that we get emotionally invested in, not just painful or difficult stories. I also am glad to hear about the good parts of someone's life. I mean, patients not infrequently will say, oh, things are going well. I guess we have nothing to talk about, but I actually care about every part of a person's life.
Yeah. So I do sometimes get a little choked up in a session, but it's in celebrating the joy of somebody's life. Like they've overcome something, they've accomplished something, they're moving forward with things, they're celebrating. And it's nice to also experience that too with them.
Yeah, that it's a victory together, right? I mean, I think when people come in, usually they're in a lot of pain and have goals and dreams in mind. And when someone gets there, it's thrilling. That's what we're there for.
All right, Jan, thank you so much for taking the time to send in a question. And thank all of you for listening. We would love to get your questions as well, so please send them in by email or an audio message at our website, callthepsychiatrist.com. You can follow us on Instagram and Facebook at Call the Psychiatrist. And if you've got any benefit from the show, we'd really appreciate it if you'd leave a review wherever you're listening. All right, take care.
What if you had to do it in the voice of Morgan Freeman?
There's been a rupture in our relationship.